Hi patient, how you doing today? Good. We're going to be doing some exercises to get you ready for walking eventually. Okay. And in order to do that, we want to start kind of on the mat here where it's nice and safe and you're protected, and we can practice strengthening some of the muscles that you're going to need for the crutches later. Okay? We have your braces on order. Once they come, we can start getting you up in parallel bars more. In the meantime, we can be doing some things here to get you ready. Okay? All right, first position here, we're going to have you lying on your back. And some of the muscles we need to strengthen. What are some of the muscles?
Triceps.
Triceps, I heard. Okay. So you can find all sorts of things to do. Okay. And there's not a right and wrong. This is where there's going to be a lot of correct answers. Okay. There's a lot of things you could do. So for triceps, okay, I'm going to have you keep your elbow on the table here and just push your hand right down into that ball. Okay. I don't want her just to do this because that would be a different muscle. It'd be okay to strengthen shoulder extensors because we need those for ambulation too. But during the checkoff, I'll be asking you what muscle are you trying to strengthen, so make sure you're specific as to whether it's triceps or if it's shoulder extensors. Okay, the latissimus dorsi. Okay, so we could do a bunch of different muscle groups. We could put the ball in between her arm here, kind of between the elbow and the chest. Keep your hand up toward the ceiling and just squeeze in that way. Why don't I want her to do like this? Right, that'd be internal rotators instead of adductors. So make sure you're having the patient do it the correct way. Okay, she's a paraplegic patient, so she won't be able to move from the waist down. So I'm not going to be asking her to do quads and hamstrings, that type of thing. We could do some manual strengthening of the triceps. There's all sorts of things you could do in this position. Okay, if she had the quadratus lumborum, we could do some of the hip hiking in this position. So patient, what I'm going to have you do is I'm going to kind of pull your leg down this way. What I want you to do is to make your hip come up toward your shoulder some, so it'll kind of look like this type of movement. Okay. First time I'm going to help you. Ready? Go ahead and pull up and back down. Now I'm going to resist a little bit. Pull up. Okay, so I can give her some resistance even on that. And I'm kind of most of my resistance is up here, kind of at the pelvis area. Give her some resistance. Okay, so you get some ideas of things you could do in this position. Okay, next position is prone. Okay, so if she hadn't learned it in bed already, we would teach her how to roll over into the prone position. What do you think is the best way to teach her here? Elephant. Okay, so in bed, did they already teach you how to do your rolling? Yes, they did. Okay, so you know that we have the your nice little leg lifter. Okay, and which side do you want to roll toward? Okay, all right, so I probably would have her scooch over to that side first, okay? For now, just for the sake of time, we've already done it in the bed, so let's use the time well here. And then we would have her put that leg over the top of this leg, and then she would do the elephant roll. I would be on this side, so she would roll toward me. Okay, so if she needed my help, I'm here. 1, 2, 3. She's good. Okay. In the prone position, if your patient automatically gets up onto her elbows, that's okay. It's pretty uncomfortable to be flat prone on a mat. Your face hurt her. So it's okay if she goes right up onto her elbows there. Okay, patient. So what are some things we could do here? Any ideas?
Shoulder extension.
Okay, shoulder extension. So let's go ahead and lie down flat for a minute. Okay. We could have her do some, if she were a kid, maybe I would have her say, okay, we're going to pretend that you're Superman. What I want you to do is lift your head way up, and then also lift your hands way up like this up behind you. Hold it, hold it, hold it, even higher, 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 higher. If I wanted to, I could give some resistance, relax. Okay, so I could do some things like that. We could do press-ups. She probably wouldn't be able to do push-ups. Her hips are going to kind of lag behind because she doesn't have, the muscles here in order to be able to keep a nice flat plank. So put your hands right underneath your shoulders. Okay, and what I'm going to have you do is just press so that your shoulders come up really high, and now go ahead and straighten out your elbows to do that, so push even higher. Good, so that'll be a press up and back down. We could do it with the hands in different positions in order to kind of pull in some different muscle groups. I want you to go ahead and get on your elbows. So we're going to put your elbows right underneath your shoulders. Okay, that's in a good position there. Okay. All right, and then what I want you to do is I want you to shift over onto this arm and then reach the other hand up and touch the ball. Good, and I'm gonna make it a little bit harder this time. Same hand, reach it way out there. Good. Now this hand, reach it way out there. Good. So again, we're getting some shift and lift type activities in. My hand is right there next to her, so if I need to, I can help give her just a little direction to get back in position if she should need it. Okay, go ahead and I'm going to have you just scooch over from it so I can demonstrate something to you. Okay, when you are on crutches later, you're going to be doing a thing, it's called the jackknife. Okay, you can get whatever position, if you're more comfortable on your side to look at me, whatever's comfortable for you. You're going to be doing something called the jackknife. And the jackknife, when you're using your crutches later, you're going to be pushing down really forcefully with your hands at the same time that you kind of flick your head forward. And what that does is that breaks the spine alignment up so that it kind of takes you out of that alignment, and it allows you to bring your feet forward by using momentum. Okay, so we're going to start practicing that a little bit on the mat here. So what that'll look like is you'll be pushing up with your hands at the same time that you'll flick your head forward. It'll just kind of look like that. Okay, they're not going to be able to use their hip muscles in order to like get up, but they can eventually use their hands in order to get into that quadruped position that we were talking about. So right now we can just start kind of getting them used to pushing up, flicking their head forward. Okay, so let's go ahead and have you do that. Okay, so it's just going to be a real quick movement. It's going to feel really silly to you. It doesn't feel like you're doing much. Okay, so as you straighten your hands, yep, really fast. Okay.
But I wouldn't be able to use my...
Your head, can you look at me for just a second?
Okay.
Your head is going to be a really hard thrust forward. Okay?
Okay.
Okay. Good, just like that's going to be starting. Okay?
Okay.
All right, so we've started doing some things with the jackknife. It'll make more sense later as we get into other positions. Okay, next position.
Long sitting.
Okay, long sitting, to get from prone to long sitting. All she's going to do is, remember she's a paraplegic patient, so all she's going to do is start walking her hands up and then eventually kind of turn around so that she'll be facing that direction.
Like just
Yep.
pushing over?
Yep, and I'm on the side where she's going toward. Once she's in position, I can kind of get, oops, there, I'm in a position here to help. I can be in half kneeling, I could be kneeling, wherever I need to. Okay, what are some things we can do here?
Shift and lift.
Shift and lift. Okay, let's start first just with your hands to the sides. Okay, and all I want you to do first, let's do forward and backward shifting. So lean forward, lean backward as far as you can, under control. And remember, depending on how much tummy muscle she has, she may not be able to go very far back. Okay, so she can kind of get a feel for where her center is with this. And then we're going to lean side to side. Good. The other side. Okay, can you do a push-up? Okay. And if we want to make it even harder or more distance up, you can put those however they're comfortable for your hands and do a push-up. Okay, what were some of the progressions that we talked about with sitting balance? Remember about lifting and then moving over to the side? So I'm going to eventually have you move your hips over this way, so let's move this hand out to the side, this one in as close as you can get it. You're going to lift up and move your hips over to the left.
That's
Okay.
not a shift and lift.
That, no, that's more shifting the hips to the side.
Oh.
Shift and lift is where you shift the weight onto one side and lift the other hand right up. Okay, so like for reaching a doorknob or something. Okay, so she could do some shifting of the body back and forth. We could do some trunk muscles. So what I want you to do is just kind of sink right down. Okay, and then sit up as straight as you can. Really arch your back. Okay, and then slouch down again. Slouch, slouch, slouch. And then sit right up. Use those back muscles so we can get some trunk musculature in there. She's definitely going to need that in order to keep an upright position. Okay, we could do the shift and lift that you were talking about. We talked about doing some Fanny Walks. Okay, which way is going to be easiest for her to go first? Backward. Okay, so patient, can somebody get my gate belt? I had it, where'd it go?
It's right next to you on the Oh, here's one.
Oh, thank you, it's on. Has to be on the floor, that's too close. Okay. All right, this way I can help you a little bit if you need a nudge. And that's a good exercise. Is that too tight or is that okay? All righty. Okay, so go ahead and get hold of the things, move them back just slightly, and then lift your body weight up. And basically her body should come just in between her shoulders there. Okay, so go backward again. Okay, and then when she gets good at that, we can go forward. If she has a hard time with her feet moving, remember we can put the pillowcase underneath her feet. If she goes forward and her legs kind of bow out a little bit, that's okay. We'll just, actually let them do that once. So go ahead and go forward a little bit. And bow, okay, and then stop right there. Shift to this side. Use that hand to straighten out your leg. Shift to that side. Straighten out that leg. So she would just kind of work her way down that way. Yeah.
Would you take their shoes off?
You could. It's just as easy to put the thing underneath it. They may not have shoes on when they come. Depends on where they are in the process. They might have their braces on at this point. They may not. Depends on if they have them yet or not. So yeah, you could take them off if that
And do you
was an
leave
issue.
their braces on?
It depends on what you want to work on. If you're going to be getting
Prone
like
to
from
standing.
prone to standing position, which we're going to be doing on Thursday, obviously then you want to go down on the mat with the braces. Most of this stuff you're not going to need the braces on the mat. Okay, so you get an idea of some of the things to do on hands and knees, or excuse me, on long sitting position.
So the shift and lift is just going to the one side and then,
It's shifting onto one hand and lifting the other hand.
so what would you call the exercise where they're like moving the push-up blocks to the side and then lifting their bottom up and scooching to that side?
I would just say like they're shifting their pelvis side
Okay,
to
so
side or
just
something like
push-up
that.
blocks
I don't
is-
know of a specific name.
Okay.
We can make one up, but you'll have to hear it. Okay? So we've done a little bit of trunk stuff, we've done some triceps, we've done some balance things, we've done some shift and lift, so we've done a good variety of things here in the long sitting position. Next position is?
Hands and knees.
Hands and knees, okay. There's two ways to get from hands and knees. If she needed to rest right now, she could rest down and then I'd eventually get her into prone and we go to hands and knees. If she didn't need to rest right now, we can go straight from this position to hands and knees. So let's go ahead and get rid of these. Okay. By the way, we have two mats. We have this one, we have a red one. This one is nicer because it's slippery. The red one is kind of sticky. So you can use both of them, but just so you know, this one is the easier one to move on. Okay, patient, in order to get to your hands and knees, what we're going to do in just a second is we'll probably go in that direction, okay, because we have more room. And what you're going to do is we're going to put you in the side sitting position, which means you're going to have your knees that way and your feet this way. And then with this hand, once we get you in that position, you're going to do kind of a 1, 2, and you're going to use momentum to get right over and put this hand on the floor over there. And your knees will automatically go into the right position. Okay. However, because you are paralyzed from the waist down right now, it's going to be really hard for you to hold that position until you kind of find your center. So I'm going to kind of stand behind you and help support your pelvis. Okay? So that'll be my position in all of this. So let's start out by having you shift onto that arm, kind of get these legs into position.
Bend them or bring them up?
Bend them just like that. Pull that one up, sorry.
Like that?
Oh man, my knees cannot take that position anymore. All right. And then what you're going to do is with this hand, remember you're going to do 1, 2, and on 3 you're going to kind of fling it right around there, get some momentum going, and I'm going to help at the belt, and then I'll also help. Let's put this foot right on top of that one so that it's not crossed when you're done. Are you ready?
Yep.
Okay. Just want to get a hold of your belt here. Okay.
One,
1, really big. 2,
3.
There you go. Okay, and I can actually help get her back up into position here. Okay, now, I'm going to let go of you for a second, okay?
Okay.
With paraplegia, she's not going to have a lot of support. She can't move her hips forward, backward, left, and right, okay? So I need to be on the pelvis, at the gait belt, whatever works. If she goes too far back, my knees are going to be there to stop her. Okay, if she goes too far forward, she can use her hands to stop herself. Okay, so once we're in this position, I want you to find your center. Kind of lean back as far as you can without losing support. Okay, and just kind of shift around, forward, backward, left and right. You feel how you can kind of find that center?
Yeah.
Okay,
I
so
don't
you
know, it's
can-
hard to tell. I mean, I can feel my legs, so.
Yeah, that's true. Okay. If she had a hard time, I could move her knees just a little bit further apart, give her a little bit bigger base. If her hips get behind the knees, she's just gonna fall right back so her bottom lands on her feet. Okay, so she wants to keep her hips just slightly ahead of her knees, which means her arms are gonna get tired really fast. Okay, in this position we can do that cat and camel. Let your back kind of slouch right down, and then arch your back up like a mad cat. There you go. And back down again, and back up. We can do some shift and lift. We could have, puzzle pieces or something in front of her to do. We could have her walk her hands to the right some.
So is that just to strengthen their back muscles by doing that?
Yeah, to get those core muscles. I'm gonna let go of you for a second. To get the core muscles, because once she stands up, she's gonna have to be able to put herself into like the Y ligament position and kind of adjust in different ways. So she's gonna need some of those core muscles.
So we don't have to worry about her head so much moving up and down like her neck?
Correct. Yeah, we're looking more at the trunk itself.
Can paraplegics be on their all fours? I mean.
Once this person will get used to knowing how far back they can go without losing their balance.
Okay.
Forward, once you're forward like this,
Mm-hmm.
they can support on their hands.
Mm-hmm.
If they go too far forward, you can see how they're just going to fall right down out of the
Yeah.
quadruped position. So it's a balancing act. Okay. All right, we're going to go straight from this position to the kneeling position. Okay. So watch carefully how I do this, okay? Because it's kind of hard to explain. Okay, patient, what I'm going to have you do is I'm going to put my knee really close to your nose. So just hold still for a second. It's okay.
Okay.
All right. Okay. Now what I'm going to have you do is take this hand and put it on my knee.
This one?
Uh-huh. And now your other hand on my knee. Okay. And then go
I
ahead.
feel like
and-
I want to fall flat.
Okay, and I have you here
Okay.
so I can support you. Now put this hand on my shoulder, put this hand on my other shoulder, and then I'm gonna walk in front of you. Okay, so I'm gonna do that again in just a second so you can see it. Okay, can that be seen okay in the? Okay, in this position then, we're gonna talk about that Y ligament. Okay, you've got that Y ligament, so we wanna really make sure that your hips are in front of your knees at this point. When you're standing up, your hips will be in front of your ankles. Get your braces on, okay? Whew, in this position, we can do some shifting, okay? And it's mostly gonna be from the waist up. I should be doing her shifting, okay? We can do some shift and lift. What I want you to do, if you have both hands on my shoulders right now, I want you very gently to touch one of them on the top of my head and the back of the shoulder.
Okay.
Okay? Good. Okay, so she can do some shift and lift. And with a real patient, go ahead and be the therapist for a second. Okay. So with a real patient, they're going to be on their Y ligaments. It's probably going to be, this type of thing. They're going to be really frightened and scared to try to do that.
Okay.
That's why gentle. Let me see here. We could also do, I could do some, where I'm pushing on her. Go ahead and fight me. Don't let me push you. Okay. If that throws her off too much here, then I may not be able to do that one. Okay. There's not going to be a lot they can do in this position, but just kind of get used to using the hands, moving the hands around. Okay. To get back down, we're going to go the opposite of what we did before.
Okay.
I'm going to go to that side just so it can be seen on the camera a little bit better. So stay still for a minute. You can keep leaning on me. It's okay. Put my knee up. Yep, put that hand down. The other hand. Okay, and then put that hand down on the floor. The other hand down. Okay, and then you can go down under the prone position or whatever. Okay? You want to see going up again just to get a feel for it, or do you have it?
Yeah.
Okay? So go ahead and get on hands and knees again where you were. Okay, so I'm going to put my knee really close to your nose, okay? So just warn the patient that that's coming. Put either hand, it doesn't matter which hand, on my knee. Okay, and then the other. Okay. This hand on my shoulder, this hand on the other shoulder, and then I just walk around.
That's really hard if I try not to use my lower extremity.
Okay?
Now,
All
BJ,
right,
what
yes.
happens with patients who are larger than therapists with that? With
Um,
you're supporting their weight temporarily on your leg.
I should still be able to do that if I feel like, you know, it's a really heavy patient or somebody I don't have good control of. I could get a chair, maybe a wall right here with a chair next to it, and they could use the chair to go up, so just have them close to a wall where the chair can be stabilized against the wall. Okay, go ahead and get back down on your tummy for a minute. We'll do one more thing. All right, the other thing we're going to do is get from prone to hands and knees position. Okay, this is where we said we're going to do the jackknife. Okay, so when she does this, the whole idea, I'm going to get where you can see me here. You're going to push really hard with your hands, not yet. And when you push hard with your hands, you're going to flick your head forward. What that's going to do is it should make her spine bend slightly so that she can kind of get her hips up a little bit. Then she'll be able to push backward with her hands in order to get to the hands and knees position. Okay, let me show what it's going to look like first, because I just love getting up and down. Okay, so I'm in this position. We're going to end up in hands and knees. So we're starting here, starting with my head up. Okay, I'm going to push really hard with my arms, my extensors, at the same time that I flick my head forward, which causes my spine to flex. And that should make my hips come up a little bit, okay? So it's kind of a 1, 2, 3, go like that, and then I'm pushing backward and then walking my hands back, okay?
Is that kind of like the worm, you know?
I need to be the opposite of the worm.
Opposite worm?
Because the worm, you kind of arch. This one you want to flex. Okay. To help her, I need to straddle the patient, kind of be where I can get hold of her pelvis. So excuse my backside to you here. Are you ready? You kind of understand what we need to do?
So, yeah.
Okay. Now, if the patient were sliding at all, what I can do is I can flex her foot up so it's kind of in a dorsiflex position there, and I can still help in this position here. Ready? So that she doesn't just slide backward. On 3. 1, 2, 3. Good job. Okay, once she's there, if I need to, I can get right there to keep her from sliding backward. Okay? Go ahead and go back down. Let's do it one more time just so they can see. Again, this is only necessary if she's sliding. So if it weren't necessary, I would just be in this position. Ready? On 3. 1, 2, 3. Okay. I would want to see the head flick forward
yeah,
a little bit more. Yeah. Okay, go ahead and go back down.
Okay.
All right, you get the idea? All right, it is 10:50. Let's take a few minutes to practice.